People are suffering, people are dying.
Way back in April 2020, in the early days of the pandemic, Seattle's Ian Haydon received his first dose of the COVID-19 vaccine.
For me, it was a very simple decision.
Ian was one of the first humans in the world vaccinated against the virus, a volunteer patient in a Moderna phase 1 clinical trial.
The opportunity was there, and it seemed like the right thing to do.
Just a few weeks into the pandemic, with the curve far from flattened and 15,000 Americans already dead, Ian and the researchers around him knew the stakes were high.
Maybe millions of lives, ultimately.
One of the study's nurses was nearly overcome with emotion.
While she was preparing the syringes as part of the trial, there were times where she teared up during it because she realized the significance of this vaccine.
Ian's second dose was a doozy.
I had a pretty high fever. I was really nauseous for a day. I ended up throwing up.
Turned out he had been in the high-dose group of volunteers. Because of his and other participants' experiences, the dosage sizes were lowered,
which seems to give all the beneficial results in the immune system without such intense side effects.
In other words, the trial worked exactly as it was intended to.
That's right.
As a science communicator for the University of Washington, Ian was well equipped to tell his story.
Ian Haydon.
And the media came calling.
Thank you for being with us tonight.
Other than that, his past year was a lot like everyone else's.
By the time we learned that the vaccines do work, it had already been more than 6 months since I got vaccinated. And so at that point, we didn't know if the vaccines lasted 6 months. So there was actually, at no point in 2020 did I know for sure that I was protected.
Recently, the vaccine team followed up with Ian, giving him one of the world's first COVID booster shots.
We don't even know if boosters are going to be needed.
If they are needed, we'll know they're safe, thanks to people like Ian Haydon.
I got an untested vaccine so that people like you and millions of other people don't have to. And we just got really lucky in terms of the vaccine technology being ready, the scientists being ready, there was research funding available to really make this happen at an incredible rate.